My last question, I talk to my 92-year-old mom every Sunday, and my siblings and I have finally tricked her into getting the vaccination. She just said she was at the end of the line and she didn't need it, but she's going in tomorrow. For those people who are reluctant to get this vaccination, what would you say to them about the importance?
Well, I think the importance is, first, I would say that people need to educate themselves, and with credible sources of information. And we have those credible sources of information, which we are one of those at elpasocountyhealth.org. So I do think that people need to educate themselves and make informed decisions for themselves. I think that that's first and foremost. My job is to provide access to the vaccine and a system to get the vaccine out to individuals that want it. I think from a population-based standpoint and a community health standpoint, when people get the vaccine, get vaccinated, the more people that get vaccinated, the more blanket health protection we are able to provide in El Paso County, and it inches us closer to getting back to full capacity and in a sense, I don't know if I want to say normal, because I think that we've all been changed through this pandemic, but it gets us to more where normalcy of living our daily lives with that health protection. So I do think it is important, and I would say the best vaccine is the vaccine that you're offered, and I to get it when you can. Sure, and I will say too that my 80-plus-year-old parents recently got their second dose, and I can say just how relieved I am, and for their protection, because my mom is a social butterfly, and it's hard to keep her in the home. So I think that that just demonstrates too. I mean, I believe in the vaccine, and it is safe and effective.
So, Dr. Robin Johnson, Medical Director of Paso County Public Health, and the question is, what would I say to a patient who was hesitant about? So I say the most important thing about getting the vaccine, and we think about this, I think a lot of people will go, well, there might be somebody else who needs it more than I do, or whatever the other things that might sway us to wait. And I would say the most important thing you can do is actually to get your vaccine, because it's not one and done. You're protecting yourself. But because of the vaccine, even if you were to be exposed, the likelihood that you could then spread it on is significantly decreased. So it's the most loving thing you can do for the friends and family and coworkers that you can come in contact with. And eventually, we will reach that herd immunity, which Director Wheelan spoke to, which is that blanket of immunity that keeps us from spreading the vaccine, the virus. So one of the things to really think about too is that in suppressing that spread of the virus, it keeps the pool from having places to kind of grow and change and turn into the next challenge for us. And so you are doing your work for tomorrow as well when you get your vaccine today. Thank you.
Thank you, Dr. Johnson. That's a really good way to put it.